I think I mentioned in my video a week or so ago, I don't think I was expecting to be your Wabash president a year ago. If you told me I would be your president and that the first thing you'd want to hear from me about was the relative merits of PCR-based testing, I would have been even more surprised. But I want to go through a number of things today, tell you where we are. The title of the presentation is What to Expect in Fall 2020. I don't want to overpromise here. There's still things that will be unexpected in fall 2020. Since the COVID-19 crisis hit, we've basically been working with about a 3-week planning cycle. Things have been changing every 3 weeks consistently, but we're down to about 3 weeks before classes start and students arrive. So this seems like the time that we should review where we are. But everything that we're going to cover today, still remains under development, and we should plan that during the academic semester, things are going to continue to change. Hopefully some for the good, certainly some will be to the challenge. That is the experience we've had since March. I'll try to remember at the end to talk about a few of those unexpected good news pieces that we've had. So things are going to look different on campus. I don't think any of this is going to be news to people, but I did want us to have some pictures so we could start to visualize what will a Wabash classroom look like with appropriate physical distancing. The good news is that through a lot of hard work, much of it planning, a fair bit of it physical labor, we have classrooms prepared. We have been able to identify a classroom space that people can use when they want to be in a face-to-face mode. We should be thankful that we were able to accomplish this. I'm in a lot of conversation with other colleges and universities. We have a lot of space on our campus, and it's paying off right now. We had a visitor from a large R1 last month who is in charge of facilities to look over some of our rooms, see if we were doing the calculations the same way that they were interpreting them. The good news is they said, yes, we are. During the conversation, this individual also shared that they have over 3,000 classes at his university that have no classroom assigned to it and no plans for how to get a classroom assigned. So we are lucky. We are lucky that we have a phenomenal IT team who has collaborated with our medical team to develop an app where each of us, student, faculty, staff, will monitor our health daily. This is going to do a couple things. It's going to be a reminder to us every day when we start our day that our health is something that we must monitor, and that monitoring our health is one of the key foundational ways that we keep our community safe. So you will take your temperature each day, answer a few questions, and get guidance on if you should go to class or if you should call the health center or call your personal physician. It'll be different to have students quarantined and isolated if they are suspected or confirmed to have a case of COVID-19. We are used to being a place that I will argue misuses the term Wabash always fights and drags ourselves to the class as a student or to the class as a faculty member or to our office as a staff member. That just has to stop. We will not be coming to work sick, all right? We're gonna stay home when it's appropriate. That's not because you got COVID, that's just because you might have a cold, you might have a flu, things that can't easily be distinguished. We're gonna get some good habits this year. We will isolate students who we believe or are confirmed to have a case of COVID, and we'll quarantine students who are suspected. The image right here is a picture of a COVID testing kit sitting in our student health center. We have a large supply of testing kits. We're ready. When we isolate students, that will be a separate facility where they will only be with other students who have a laboratory confirmed case. Here you see a picture of what that will look like. I will note we actually had this facility ready in March. This was prepared over spring break. We've been ready for this for a while. The number of beds that we have, just to give you an idea, is about twice the percentage of what large universities are holding back. Things are going to look different because we're going to wear masks. All right. I took mine off to do this presentation. I keep my mask on my neck all day long. When I leave my office, I put it on. It turns out not to be a habit that hard to get into. I will say a month ago, I was very much nervous about this. It just seemed so against the way that we operate. But over the last month, as I have adapted to wearing my mask every time I leave my personal space, I've actually been pleasantly surprised at my ability to communicate with my colleagues, to enjoy walking around the campus. This week, Dean McDormand and I sat outside for our meeting, well physically distanced, with our masks on. So we had the triple protection: outdoors, distance, and mask. We really had a great meeting. It didn't feel any different from what we do in our day-to-day. So I think that we will adapt. Everyone knows the mask is key to keeping our campus healthy. Everybody's going to get a couple masks when they come back to campus. I hope everybody brings a couple more. I hope that we see a lot of different masks on campus. And I think that this is one of the ways that we will show that our campus can act responsibly. This part will be a little jarring when you come to campus. When you walk in a building, when you walk by a building, you're going to see a lot of signs. And that's not a usual Wabash thing. And I'll admit, a little bit like the mask, it was jarring for me at first. The first couple weeks when I would walk up to a door and see a bright red sign, it felt wrong to me. It felt like I wasn't in the place that I have loved for 22 years. But after a little bit of adaptation, I see it as the reminder. I like to be reminded to wash my hands thoroughly. I like to be reminded that we are all responsible for both our personal health and the health of others, and that some relatively small changes in our actions, like using one stairway for the up and another stairway for the down, can dramatically improve our community health. So you're going to see a lot of signs. It's important to note that what we're going to do and what we have done is not fundamentally different from what any residential liberal arts college in the Midwest is doing. I will say that I have been extremely happy with the cooperation that we have had from our partners in the Great Lakes College Association. There are people at all levels meeting on all kinds of topics with their colleagues in the GLCAs and sourcing the good ideas. So it's not a matter of having to reinvent the wheel. And we've also seen a tremendous amount of creativity about how do we address the issues that public health officials give us guidance on. So all of the folks in our group are going to use some of your basic things: physical distancing, face covering, hands cleaning. Everyone will be doing some type of symptom monitoring. All of us have been working over the summer to modify our physical spaces under the direction of public health officials. As we return from the student side, it'll be a little different. We'll do scheduled move-in days and staggered. That's different from Wabash. People tended to just kind of show up. but we need to do this in an orderly fashion this year. We will have some study abroad. This is an area where we are a little bit different. Many colleges just put a blanket cancellation on all study abroad. We've tried to work with individual students, and if they have a study abroad program that is both open and works in terms of visa requirements and the health risks are acceptable, we have been still supporting those students. At least right now, that's our plan. We continue to plan for spring study abroad. This has generally been my philosophy. Give everyone the opportunity for success, not we don't throw in the towel any earlier than we have to, but when appropriate, we will throw in the towel. That was the experience back in March when we canceled the trip, the immersion course trip to Italy, but we did continue with the trip to London and to Northern Ireland. I know the students that went to Italy were disappointed. I also know that the students and faculty who went to Northern Ireland and England had a life-changing experience. These things weigh on me. I know we're going to have to make tough choices. We'll continue to make the choice that leaves open the possibility for students up until the point when we just can't do that anymore. I'll talk a little bit later about athletics. Lots of questions there. I think the emphasis is just lots of questions there. Developing robust but safe student activities is a real focus of work right now at Wabash and across the GLCA. And in 2 weeks, the chapel talk will be given by our student life team, and they will talk about that. They are working with our students and our student leaders to do these things. It's important that we have a rich but safe campus environment. On the academic side, I just can't say enough for the work that my faculty colleagues have done with Dean McDormand's leadership, with a number of faculty groups, from the Teaching and Learning Committee to the Academic Policy Committee, to develop a plan to provide a quality mix of face-to-face, hybrid, and virtual course formats. This is what all of our peer institutions are doing. I feel really good both about the things that our faculty have developed as best practices. I consider them to be setting a bar for other colleges right now, and I am confident every student will have a quality academic experience. We're going to start early, we're going to end early. That's pretty much happening at all of the other colleges. I will say some colleges are going to have some virtual classes after Thanksgiving. Nearly all of them will administer the final exams remotely. I want to thank the faculty on our Academic Policy Committee who thought really long and hard about this and really made the convincing case that we should have all our final exams done before students leave. In the campus environment, we can give our students the best support possible. Once they leave, the support will be diminished and it will be differential. And I was very swayed by their argument that it's not right to students to send them home to different environments to do their final exams, which often contribute importantly to their final grades. So we're going to do final exams before Thanksgiving. We'll have Wednesday to travel home, and everybody will have a substantial break. But I do just want to say, I really appreciate the way our faculty have remained student-centered and helped us understand what really matters at Wabash College is that academic experience. Just in case you're interested, there will be some, somewhat more substantial changes to academic programs at some of our peer institutions. Albion and Earlham have chosen to go the model of doing 2 shorter terms within the semester. Students will take 2 classes at a time, and they'll be on a compressed 7-week format. Our friends at Oberlin, I think, are doing something very creative. They're going to do 3 semesters in a row with students on campus, 2 of the 3 semesters. So their academic year will start about when ours is, mid-August. It will not end until early August of 2021. So while all of us have exchanged good ideas on best practices, different colleges have come to slightly different places that make use of their particular strengths and their particular challenges that they face. All of us have some strengths in common, being in a more rural location, being largely, or in the case of Wabash, entirely residential, takes things like mass transit off the list of concerns. Having everyone on campus together, huge benefit. Extensive facilities. Our colleges tend to have more space than they really actually needed. That is nowhere more true than at Wabash College, where we have maintained the same roughly student body for many decades, while we have continued to add to our physical space. That's why we've been able to find homes for the academic classes. It's why we've been able, with our existing housing stock, to identify plenty of bed space. I will say, and you'll hear more about this from Dean Welch and the student housing side as you return to campus, there will be changes. We're following the direction of the Johns Hopkins School of Public Health, who has provided extensive information on how to safely house students in a dormitory or fraternity environment. And so while you won't see bunk beds on campus, and you would not see the traditional setup of some of our cold dorm things, we are able to space the beds out in the recommended way. And in fact, we did not lose any housing capacity as we did this. So we've been really fortunate that over the years, the college has invested, maybe some days you might say overinvested in our physical plant. It is paying off hugely this year. Beyond places, you're going to see some people serving in different roles. I had announced previously that Ann Taylor will serve as my special assistant for COVID-19 response and planning. Just as we are so fortunate to have facilities that enable us to return to residential education, we're also so fortunate to have Ann. Ann had just completed during her sabbatical year a leadership development program with the American Council of Education that not only sharpened her skills, added to her toolbox, but it also connected her with colleges and universities of all sizes and all types all around the country through her classmates in that program. They have been fantastic resources for us. Additionally, I am personally grateful because in Ann, I have someone who I've worked with for well over 20 years, and I have 110% confidence, both in her ability to execute and her ability to understand our unique campus culture. Allie Metcalf has previously served as our travel coordinator. Allie will step into the special role of COVID-19 logistics specialist this fall, make sure that we are distributing and keeping up with distribution of everything from signs to hand sanitizer to cleaning supplies. If those of you who don't know Allie, she's fantastic. She moved to that level of 110% trust that I have for the work that she did, helping our students who were stranded during study abroad last spring when their programs were canceled, and literally stayed up all night doing that work. She has 110% of my confidence. She has a background ideal for this. Jill Rogers and Omi Olmstead have agreed to take on one of the most important jobs at Wabash College. They will lead our care team. The care team is a group of students who will serve as health leaders on our campus, peer educators who will step in and work with small groups of students on all the many ways that we're going to adapt to this new environment. Last week when I sent out my message to the campus, one of my 4 points was we needed to be honest with each other and with ourselves. I'm going to use this opportunity to be honest with you. I made a mistake a few weeks ago when the care team program was designed and implemented and began to be implemented. I said, this is exactly what Wabash College needs, but I made a mistake. I had a doubt that we could find a group of students to commit to doing this important work. I was completely wrong. We actually had more applicants than we have spaces for. Wabash students stepped up to take on a role to help their fellow students keep this a place that can have the residential experience that they cherish. It gives me great hope for the semester. And honestly, I don't mind it all being wrong on this one. So where are we? I've tried to classify things into 3 camps. The things we know exactly how they will work out or pretty sure about how they'll work out. Some things that still have decisions to come in the next few weeks, and some things that I can't really give you a timeline on the decision because it awaits information that we still don't have. I shared on here a quote from a Wabash alumnus who's been very helpful for me in our planning around our COVID-19 response and how we would bring folks back to campus. Dr. Stephen Jay is a distinguished faculty member at the IU Fairbanks School of Public Health. He's a door opener. If I use his name, people take my phone calls throughout our state and local public health agencies. If I use Dr. Jay's name, I can talk to people. Dr. Jay has also been extremely generous. He has connected us with faculty colleagues at the Fairbanks School of Health. He got one of his faculty colleagues to write up an analysis of the epidemiological considerations that would go into a COVID testing plan for a campus of our size. He's done incredible things. And in one of his emails to me, he ended with a message: you can't go wrong if decisions are based on some combination of science, ethics, and common sense. And for the last couple months, has been a huge driver for me. So what we're going to do is I'm going to walk us through one example of a process I know real well, a process that is in a final decision-making point, and then a process that I'm just going to tell you we have to wait for more information to know. So the first one, what are we going to do if a student wakes up with symptoms that could be indicative of a COVID-19 case? Let's say he wakes up and he has a fever. Well, he will put that information into the health monitoring app, as well as answer other questions. Did I have a sore throat? Did I cough? But if you put in, if let's say he puts in some symptoms and it raises a red flag, the health center will be notified. His phone will not have the green check that I showed you in the example a few slides back. It'll have a red stop sign, and it will give him messaging about how to self-quarantine, who to call at the health center, or if it's on the weekends, how he will get who he will contact. The care team will be notified. The care team members will address his specific needs. That'll also include just somebody to talk to, keep his mental health up. Somebody who's checking in on him. Food will be delivered to his room. So, all students will have a red and green Actually, everyone will. All of us, faculty, staff, and students. And so when a student comes to class or goes to his WISE job, for example, he will show his phone and show that green check. That's what happened. But let's focus for a moment on the case where Wally's got some symptoms that concern us. All right. Oh, before I do that, what if faculty or staff, what if I have a fever? All right. I'm not going to come to work. I guess in this case, I don't exactly have a supervisor, but I'll call Kathy Metz and let her know I'm not, I have some symptoms that have me concerned. I'm going to call my primary doctor. I'm going to get some advice. I'm going to follow through with that. If I felt okay, I would work remotely, as many of us have been doing. If I didn't feel up to that, I would reach out to members of my team to fill in and have my work done. Now, let's go back to the case there where Wally has some concerning symptoms. Well, one of his messages will be to contact the Student Health Center. Campus physicians will determine if he needs to be tested for COVID-19. We have the ability to test for COVID-19 in the Student Health Center. We will be using a nasal swab that will then be sent for a PCR test. This is the gold standard in COVID-19 testing. Just to share some of the better news about this, these will be a nasal swab that can be self-administered by the student under the supervision of health center personnel. So the health center does not have to jab something up your nose. It'll be more the case that you'll take a Q-tip-like thing, swab your nose, put it in the test tube, seal it up, put that in an envelope that the Student Health Center will then ship out. We have contracted with a company both for the test and, importantly, for the capacity to have them tested in 24 to 48 hours. We have gone with a company that has only contracted for the finite capacity of their lab. They have not contracted for more than they can actually produce. Now, if a faculty person has those symptoms, of course, they will be in contact with their primary care physician who can send them, if appropriate, for COVID-19 testing. We're fortunate right now in the state of Indiana, and I hope this continues, that our testing capacity in our state is quite robust. In fact, anyone, even an asymptomatic individual right now, can get a COVID-19 test at one of the Indiana State Department of Health sites. You can Google Indiana State Department of Health COVID testing if that's something that you're interested in. I know many people have had the test. My spouse, Wendy, has had the test. She was randomly selected, actually, by the Indiana State Department of Health for some of their random screenings. So in terms of testing, we've got the test, we got the plan, we can get the results with a quick turnaround. Well, what will Wally do while he's waiting? He will need to go to the Student Health Center, a site separate from the health center, but adjacent, so we don't mix potentially ill people with people that are just going to the Student Health Center, to have a non-contagious condition examined. We will quarantine students. So I'll try to emphasize some of the terminology here. I have struggled to keep this terminology straight. Quarantine is someone who may be infected. We don't know, but they've shown some signs that make us nervous enough. So they will quarantine, where they will be isolated from others, will have their meals delivered. That may be that they go home for that period of quarantine. We may have them in a room in our living unit, or we may even put them up at an alternative location. Faculty and staff, again, would quarantine in their home under the guidance of their primary care provider. Let's say that we've placed Wally into quarantine and the test result has come back positive. That is information that will go to the student health center and to the student. At that point, we would move the student to isolation. So the difference between isolation and quarantine, suspected potential case of COVID, isolated laboratory confirmed case of COVID. So in isolation, we are trying to prevent any mixing of students who are ill and anyone else. So the good news is in isolation, you can actually mix with others. So if two students had both tested positive, they will be able to interact with each other over in the Hayes house. A positive test will also trigger contact tracing. I'm sure everyone is familiar with this term by now. That contact tracing will happen through the Indiana State Department of Health and our local public health agency, because they will be notified of every positive test. We will supplement that with our own contact tracing, which we believe we can implement faster and that we can use the information that we have in our campus data systems. For example, who the roommate is, who else is on that floor, what classes they've been in, as well as things that our student life team will keep track of, like what clubs is a student in. So we'll ask students for that information when we test them, because generally the contact tracing is trying to identify folks that you've come in contact with for the 2 or so days previous to showing any symptoms. And people's memory is best when it's fresh. So we will get that information. Hopefully the large majority of the time, we will not need to act upon it. It's good to remember that the percentage of COVID-19 tests that come back positive is actually fairly low, even when sent by a trained physician. The rate in our local area right now is running around 9%. I'll show you some data in just a moment. It's run as low as 4 and 5%, but even at our peak, when we were really trying to conserve tests in our state and really not trying to test any asymptomatic individuals, it was still the case. The vast majority of cases are coming back negative because many, many things look like respiratory disease. Probably lots of us have had a nervous moment this summer when we had a sore throat. And then we realized, I often have allergies. The bottom line is that we will test in cases where we really don't think that that it's a high likelihood, but we're just going to do that out of an abundance of caution approach. So to now move to testing strategy. When I started this PowerPoint, I had testing strategy as something that was in the final decision-making group. I will share, I think all the decisions are made, but it's literally been finalized in the last 48 hours. I left it in the PowerPoint because I really think people are very interested in how we use COVID-19 testing. Let me say at the beginning, testing is an important tool. It is nowhere near the magic bullet that people sometimes feel it is. Symptom tracking, hugely important. And both of them dwarf in comparison to physical distancing and mask wearing. But COVID-19 testing is an important piece, so I want to walk you through what we're going to do. Well, I've told you that anyone with any students with any symptoms are going to receive a COVID-19 test. Why is that a good idea? Well, if it allows us to identify a student who really just has the common cold, so we don't need to put him in isolation. We don't need to put his roommate in quarantine. It will reduce the time lost from class, work, other activities. So we are testing the symptomatic students, hopefully to find the mostly good news that they don't have COVID. Now, is there any reason not to do that? Well, false positives are always going to be a concern in COVID testing. Frankly, they have not received the attention that they should in the national conversation about how we address COVID-19. In the case of a symptomatic student who's had a fever or a cough or a sore throat, it's only a minor concern because we were going to need to isolate that student anyway based on suspected or potential case of COVID. So if he has a false positive, he's not really any worse off. And the many negatives that we get help us. So the bottom line, we will liberally test symptomatic students at the Student Health Center using the PCR-based kits that we've contracted through with a company called Tempus. Random testing or general testing of asymptomatic students. So this is the testing of students who have shown no symptoms. Well, random testing helps do a couple of things. One, it will identify asymptomatic cases. I'm sure people have read and seen the statistics that indicate that a large number of people with COVID-19 never exhibit symptoms. There remains significant scientific uncertainty on that percentage, but certainly there is a percentage of folks who do not either notice symptoms or don't exhibit symptoms. With the daily health monitoring, we hope to reduce that number by having people look closely at their symptoms each day and take their temperature each day. But certainly the science also suggests there are some true asymptomatic cases out there. Random testing will capture some of those and give us the mechanism to isolate those students so that they are not asymptomatic spreaders. Additionally, random testing allows us to estimate the level of campus prevalence. And the level of campus prevalence will determine lots of things going forward. It tells us how we're doing as a community in terms of those best practices. Is the level staying the same? Is it going up? Is this something that we need to worry about? Do we need to introduce additional interventions? The why not is the piece that really is not getting enough attention. False positives lead us to unnecessarily isolate healthy students and to put their close contacts into quarantine. We may have an opportunity to do a retest, but even that will come some days later and we'll have several days to wait for the results. Dr. Douglas and Dr. Roberts have been very frank with me about this. Quarantining someone, especially quarantining, means putting them all alone. And that's not a position that that's not something that we should take lightly. We need to consider the ethical consequences of every action that we take. And putting someone unnecessarily, putting them in the place where they have to take a test and where they are quarantined unnecessarily must be balanced with the public health benefit of that I've mentioned previously. We also must be cognizant that right now, while Indiana testing capacity is strong, we don't know what the future holds. Testing capacity across the nation could easily become stressed again, and we'll have to consider if our use of testing asymptomatic individuals might possibly be keeping other parts of our country from testing symptomatic individuals. So we will have to continue to think about this. The bottom line is that our plan is to randomly test students at the Student Health Center using those same Tempus PCR-based kits. We have contracted for tests that will allow both the symptomatic and the asymptomatic tests. The sampling rate is going to be determined by both campus and community prevalence. I want to thank Chad Westfall, who has worked with me on doing some of the calculations for specific populations of the Wabash size to determine how much testing do we need to do to measure the needed level of precision. I said that I want to show you a little data. I know probably lots of you are following lots of different websites. I have not really found a website that puts the graphs up in a way that worked for me. So what we've done with David Dallenberg's help, we have been compiling on a weekly basis our local environment. Here's the number of cases. We were nicely going down. We are experiencing some rise. The quantity that's probably the most informative is the percentage of positive tests. And so you do see that back in early June, we were in a great space. We were down nearing 5%. If you get down to 3% or so, that's considered really excellent work. We're now right up, we're up close to 10%, which is more concerning. The number that's very helpful for us to think about also is the data that came back from the Fairbanks study. Fairbanks did a large random sample of 5,000 to 6,000 individuals. And what they saw when they did the testing in late April, about 1.7% of people were currently infected. In late May, it was down to around 0.6%. And so when we think about what percentage of our community might have the disease, this is a very important measure. So now I'm going to get to the part probably that people are very interested in. Return to campus testing. There's been a lot of conversation about this. Do you test all the students when they come? Well, I've already told you about things that have concerned me about blanket asymptomatic testing. But over the last week or so, an opportunity has arisen where we could do our return to campus testing, and we could do that at students' home locations. So we are going to partner with CVS to have tests done near the student's home. We still will have to have that concern about false positives. I also want to make sure everyone's aware, do not get a false sense of security. The test is a snapshot in time. Additionally, there will be logistical challenges. We're also doing things that are right now in a mixed message from public health officials. Our local officials, our local county officials have endorsed this plan. The State Department of Health in Indiana does not favor this back to school testing right now. I'm hearing that the CDC currently does not. We're hearing rumblings that they may change that in the next week or two. So I think we may be in front of that. The bottom line is that details will be forthcoming about how all students can get a test the college will pay for at a CVS near them. We've ran all student zip codes through the CVS list of stores that offer this. Not all CVS stores offer this. Our Crawfordsville store does not, but they have over 1,300 sites around the country. 97% of our domestic students are within about a 40-mile drive of a CVS. So that's a piece. So that's a decision that's been made. 48 hours ago, this was one waiting in final. Here's one that will have to wait for more. And I know lots of people are asking about athletics, but the bottom line is this is a challenge because not only do we need to develop our own processes and procedures, but it's a collective action with the other colleges who we would compete with. Our sports league has made some preliminary decisions. We would begin competition delayed, not until the middle of September. This gives us time to assess and plan. We are going to not participate in play outside the league. The idea being that if we can all come to a consensus on best practices, We will just compete with those who have agreed to those same best practices. We won't be doing overnight travel, and we're going to come up with detail. We've all agreed that we will come up with a common testing protocol. The physicians of the different colleges are meeting on this already. They are developing a proposal. Now, I will tell you that Oberlin and Kenyon have decided that they just can't do this. They've made that choice for their campus. Wabash continues to work towards a fall athletic season, just as we've continued to work towards study abroad. We're going to do everything possible to not limit student opportunities, but we really have to wait the work of others before final decisions can be made. I know I haven't covered everything, though I have covered a lot. We'll continue to send out messaging as more of these things become available. I would urge you to continue to read the COVID website at the college and continue to submit questions to covid@wabash.edu. More than 60 questions have been submitted and answered, and more will be out there this week, and more will be out there the week after. Next week, I would invite everyone to listen to Dr. John Roberts' virtual chapel talk. Dr. Roberts' chapel talk will be directed primarily to students, but he has shown me a draft of the script. I think it's good things we can all learn from. I don't know that Dr. Roberts has a title for it. If I could give it the title, it would be Straight Talk with Dr. Roberts. It is very direct. He pulls no punches, and it's an important message for our students, and I think an important message for all of us to know. He will cover, it is going to be a comprehensive education program for all of our students. The week after that, Student Life will be given a virtual chapel talk where we can talk more about things that our students and our Student Life staff have come up with, things that will make this a great semester. To summarize, a lot of work, a lot of time, and a lot of money has gone into planning for a successful semester. But everything that we have done is to set up the opportunity for success. Nothing can guarantee success. Success will be determined by the individual and collective action of around 850 students and a couple hundred faculty and staff here to support them. The individual decisions that you make for your own health and to protect the health of others is what will determine if we are able to offer the residential educational experience that students came here for and that faculty and staff came here to deliver. There are lots of doubts out there. I know. I also, though, see that this is a tremendous opportunity for us to show what a small community committed to a mission can achieve. If we allow ourselves to read the hopeful news and the bad news, we can see places where mask wearing eliminated COVID-19. We can see communities and countries where COVID-19 did not stop them from achieving their mission when everyone worked together. We've spent the last several years with a lot of questions about the value of college, actually, and especially the value of a residential liberal arts education. I'm hoping this is a chance for us to demonstrate exactly what we can achieve. In the end, everyone needs to be careful. Individually, we must be cautious so that institutionally we can be bold. That's what I want us to be, an institution that is bold in working to achieve its mission under the most difficult circumstances. I'm sure some of you have questions and, and doubts. I've had them too. There are certainly hours of the day when it can get me down. If I reflect though on the last several months of what's happened at this college, I can identify several opportunities where we took the chance to be bold, and it paid off. And it paid off in achieving things that many people would have said were very, very unlikely. There was a time in late March when CFO Cooks made the bold move for us to skip our endowment draw. That bold move, along with a lot of careful cash management, brought us to the position where our June 30th endowment value was $324 million. I think most people would have said in March and April, the chance of us retaining our endowment value was impossible. A lot of colleges around the country canceled their day of giving in the spring. Dean Jansen and her team said, we gotta be bold. We had a record-breaking day of giving, $1.2 million, which was a key part of what ended up being a record annual fund this year that we concluded. I can't count all the times that Dean Timmons and his team brought bold ideas to President Hess and I in the spring, bold ideas that we implemented in the late spring and that have us sitting actually at a place where we have more students planning to come this fall than we did last year. We've had bold moves across different areas of the academic program as people have developed innovative pedagogy, innovative course delivery. I spoke to Aaron Elam last week. I said, Aaron, how are things going? He said, everyone's hoping for the best and they're planning for the worst. I think that's probably not a bad place to be. We're going to keep planning for all eventualities, but I want to make sure everyone's hoping for the best. And I want you to think there's a real chance we can do the best. We can have a semester that we're proud of. We can have a semester that everyone who lives, learns, and works here can be proud of, that they can point back to and said, we came together and students did things that everyone said students can't do. And the faculty and staff gave them an educational experience that motivated them to do those things. So continue everything that you're doing. We will continue to work towards a great semester. I thank you for all the work that's gone into it. And I thank in advance our students for the work that they're going to do when they return to campus. I need you to know every bit of planning that's gone into this semester has assumed responsible behavior. While other college presidents are working out worst case scenarios, I refuse to do that. I refuse to do that. We must plan that our students are going to rise to the occasion. Men of Wabash, this is yours to execute. It is your responsibility to live out the mission of this college and to show what it means to be a gentleman. If we do that, we give ourselves a chance for a great semester. Thanks so much. Keep those questions coming to covid@wabash.edu. Stay safe, stay healthy, Wabash. Thank you.